people we share our personal belongings with. For instance, you might find yourself in a place because he's your guy, you don't know what he's passing through, and you are sharing your sponge with him, you are sharing your bathing soap with him, you are having everything in common with him. At a point, that person might have an infection which have been inside him, but it is not.
Hello, good day, everybody. Today we'll be talking about some infections that we can get from non-sexual activities. So sometimes most of us may be having one infection or the other. We just think that is a normal thing. Today we'll be discussing it with one of the medical practitioners on different type of infection that we can just get that will be suffering from without even knowing. Because most of us think that most infection that it can be transmitted from one person to another through sex. But there are some infection that can be chronic infection that it can be transferred from one person to another without sexual activities. So let's hear from the medical practitioner.
Yeah, thank you so much for inviting me once again into your channel to discuss this very vital topic with Nigerian youth and everyone at large. I think that this word infection is beyond our normal scope of understanding. Yeah, I say this because people just think that infection has to do with once you have sex or you have an affair with a lady or a guy, as the case might be. But totally, it is very far from that. We have different infections, something like RTI, UTI, and you can still get these infections without having any sexual intercourse. Like when I mean RTIs, I mean infection that has to do with your respiratory tract, starting from your chest down to your mouth or any other thing. For instance, if you're having cough is an infection. There is antibiotics that is meant for it. I don't know if you're understanding. If you are having a runny nose, it's still an infection. There are some drugs specified for that those kind of infection. Once you take those drugs, it will help in breaking down of those infections in your body. Then it will be solved. Another part of it, which is very, very common, is when it has to do with skin related infection. This is the one that is always so obvious in the community, but that is not the apex. Although I can't say that there is an apex to sickness, because what killed Mr. A might not be the thing that will kill Mr. B. Or moreover, the sickness that Mr. A survived, Mr. B might go through it and will be unable to survive it. So we will look at the basic scopes in this infection as a topic, starting from the RTI down to the UTI. Now, what is infection? This is very, very important. We cannot explain fully what infection is without first of all pointing out reactions, symptoms, what you will see in your body and discover that at least you are having some abnormalities in your normal skin. For instance, some infections are not visible. You might be passing through some infections in your body, and people who are looking at you might not know that this is what you are going through. But you that is having it, you will be discovering it on day after day. And aside that, it might be causing you a lot. Now, most of these infections, if we critically examine the way we get them, we discover that most of them are gotten through our carelessness, the way we manage our things around us, or the way we manage our bodies. But let's start first of all with explaining details about infection. Infection, on our normal understanding or at our level of understanding, is when there is abnormalities either in your skin or in your body, inside your systems. Now, we are mostly focused on the one shown in our skin, but that is not just it. If you treat infection based on what you are seeing, you are only concerned with what you are seeing on your body. But on a normal way to treat infection, you first of all consider where it is coming from, the reason why this thing existed for the first time, how to stop it right in the inside your system, then before clearing the outer part of it. I am not a professional medical doctor, But based on my feed, I've understood that you can easily clear out the visible part of it. But once you fail to treat it from inside your system, at a point, those infections will play resistant to drugs around. So once you notice any abnormalities in your body, maybe itching or rashes or boils all over your body or even in your private parts, the best thing is either you consult a medical practitioner who knows his onions on this very field, or you go for medical visitation. You visit a doctor and explain what is happening. Maybe by then they will run a test. If it's in the Western world, people do go for test even without noticing anything. Now let's start with some infections and common causes, with the one that is mostly within our vicinity. First, this issue of scabies. I will explain scabies in such a way that people around will understand it in a more liking way. For instance, we normally complain that we are having some boils in our body. At a point, it will be itching you. The more it's itching you, the more it becomes sweeter. Some people will call it that it's oko sweetie with our dialect. Oko sweetie, that is scabies. You'll be scratching your the more you are scratching, the more the boils are coming out, or they are increasing in terms of size. Now you can get scabies even in your manhood or all over your body. It might come even without having sexual intercourse. It might come it is very very rare to happen even without a sexual intercourse. For instance, where you are going, your normal toilet, your toiletries matters a lot. Sometimes we find ourselves in an environment where the way we manage our toiletries is always so awkward. No proper cleaning, no proper hygienic in those sensitive areas. Mr. A will come in, defecate and go. Mr. B will come in, defecate and go. Like in a public environment, you must always maintain your personal hygiene when it has to do with your toiletries. Most of all these scabies that we are passing, 99% of them are gotten from our toiletry place, the place where we go to defecate or to urinate, as the case might be. Because you might not think that once you are urinating on the surface of the soil, you are covered. No. So far, Mr. A is coming there to urinate every day. Mr. B is coming to urinate every day. Remember, ladies and the guys are not the same in terms of how open their body is. I'll be Now, a guy can come easily urinate and go. But as a lady, so far you are stooping low, you are going down, you are bending, you are going down to urinate. Possibility of contacting infection from that very spot which you are urinating every day is very, very rare. It is 80%. So you first of all monitor where you are going to urinate. Even if you are making use of public toilets, you need to have your own, at least your own Dettol, all these antiseptics. You need at least your Dettol, your eyes out, any of these that can help you to kill germs. Two, again, is water that we drink. Our body systems are different. There are some that once they change environment, they will start reacting to those environments. Maybe because they change the water that they are drinking, or they just drank from a water that came from rainfall. You discover that all of a sudden they'll start having boils in their body, or they'll start having cough. Whereas there are others that have been living in that environment for years, and you will never notice anything like that. They are used to that environment. So once you change the environment and discover that you are reacting to this very situation, what you do is try to adjust a little bit. You can boil your water. You can, at least uh, uh, handle some certain things to a little bit hygienic state. For instance, you can add the tools. This helps to kill germ, although sometimes we overlook the works of these antiseptics, but they do works. Secondly, we must be very very careful with the people we share our personal belongings with. For instance, you might find yourself in a place because he's your guy, you don't know what he's passing through, and you are sharing your sponge with him, you are sharing your bathing soap with him, you are having everything in common with him. At a point, that person might have an infection which have been inside him, but it is not reacting on the surface of his body, then because you are now making use of the same sponge with him, you will definitely, or you might at a point start having a same infection. For instance, during my SS3, while I was living with a guy, the guy was having infection, but you can hardly notice that. Now, until then, I had no view of what infection looks like until I packed into that very compound. I was making use of everything with him. I saw him as my brother, although we are from the same different families. But this connection of your classmates, we are living together, you share everything in common. So at a point, I was having a lot of boils in my body, boils all over me, even to my private parts. The time that after 1 week of living in that very compound, it was unbearable. I have to go back home and treat myself. So whenever you discover yourself or you find yourself in an environment, try to maintain your own personal hygiene. If this is your sponge, don't share it with anybody. That is your sponge. Make use of it. So that at least once you're having issues, you know where they're coming from. Not just that you're having issues and you can't trace the origin of it. Now, if you find yourself in the environment whereby you make use of general toilets and you have no option, what you will do is this: get a bucket. This is for you, not for any other person. I'm trying to talk about the preventive measure because we Nigerians, we are more concerned with how to control instead of how to prevent. You first of all take preventive measures. Then, if by chance it escape that preventive measures, then you start considering the control measures. So one of the preventive measures is try to maintain and keep your personal hygiene, which is with the things that you are handling alone, your toothbrush, your bathing soap, your boxers, your inner wears and everything. These are your personal belongings. You don't share it for any reasons. You keep it as your own. If your neighbor don't have, he should look for alternative, not yours. Two, you try to manage your environment. It is not an excuse to say that you got an infection because you are living in a local environment. It's very, very wrong. In any environment you find yourself, you must look for a way to survive in that environment. Adaptation matters a lot. Now, what you do is this: you find yourself in an environment whereby you are making use of general toilets. First of all, look for a means of creating your own personal toilet by buying a bucket. This thing doesn't cost you much, but I think we are more interested in seeing before believing. Get the bucket first, keep it, make use of it, go to toilet with it, then flush it. I don't think you can get infection from that. Now let's talk about other control measures, drugs that you can use whenever I discover such a thing. Although cases might differ, some do treat it with all this local Igbo medicine or Agbo, anything at all. Sha. But I am much more concerned with uh, uh, my field and how I treat them. Understand? So at this point, I will be listing some medical aspect of treating or be controlling infections when you discover them in your environment. Now, for scabies, I am pointing at it because this is one of the most commonly seen infections in our society these days. You can take ceftriaxone injection 1 gram per day for 5 days, but I don't normally give injection for scabies. I prescribe drugs such as Senocide, Mectizan. That Mectizan is a brand of ivermectin. So you take Mectizan tablet, 4 tablets for this adult dose. Mectizan tablet, 4 tablets once for start. Once you take it, you won't take it again till after the next 6 months if it persists. But you take it just 4 tablets once. Then loratadine, 10 milligram morning and night, or 10 milligram daily. Then Senocide, 2 tablets TDS, that is 3 times in a day or 2 times in a day, anyone you prefer. Then you get at least a card of good and quality antibacterial such as levofloxacin, sparfloxacin, uh, or this ciprofloxacin, any of these three. But I prefer levo. You can even get this Sporidex, that's a brand of sparfloxacin. Then you take 1 tablet in the morning, 1 tablet at night. Then you get any anticorticosteroid such as dexamethasone, or prednisolone. What they do is that they help in breaking down those boils in your body. And you can get any cream, something like benzibenzonate, although it is painful, sha, but it can help in clearing those spots. But those tablets that you are taking inside will help in clearing the sickness down in your systems. So I think these are the basic information required or that you need to manage your health when you are having infections or when you are suspecting infections or even when you are trying to take a preventive measures.
Okay, so please, I hope you audience have hear from his advice. So please, I want you to subscribe, comment, and press like button. It will help in the YouTube algorithm. Thank you for watching.
Thank you for